Welcome to the Health Accomplice podcast. I'm your host, Alex, a functional nutrition guide and health enthusiast. The Health Accomplice brand is all about honoring your individuality. There is nobody like you. My mission is to remind you of your own authority over your own health and wellness. If you're interested in optimizing your well-being, in growing into your most happiest and healthiest self, and in taking your power back, you're in the right place. This podcast series is all about providing you with the information you need to make your own decisions on what's best for you and your wellness. I'll be interviewing experts on all topics related to our body, mind, and spirit. My goal will always be to provide you with a holistic view and also practical tips on how we can apply these concepts into our everyday lives. So welcome to the podcast. I am so happy you're here. Hi everyone, welcome to the sex episode. I really wanted to do an episode around this topic because I think it's so important for our overall health. And it is such a private topic, but I think, having a place like a podcast to talk about it where it's not so personal and we can normalize a lot of things, I think is really important so each one of us can feel empowered in our sexuality and have better experiences with it. I recently read an article from Mark Manson. For those of you who don't know who Mark Manson is, he's an American author and a blogger, and he wrote a few books, The Subtle Art of Not Giving a Fuck and Everything is Fucked, and a book about hope. I've read all three, highly recommend. I get his weekly newsletter on Mondays, and one of them really caught my attention. It was about the fact that we aren't having as much sex as we used to have. And there was this assumption that during the pandemic, there would be a baby boom because everybody was spending more time at home. But in fact, that's not necessarily happening. And it's probably because sexual desire actually thrives off of novelty and spontaneity and distance and challenge and mystery, and none of that really happened during the pandemic because we couldn't go anywhere, and we'll talk about that more in this episode. But generally speaking, I was just super interested in the fact that as a society, we are having less sex today. And that's super interesting to me because I'm curious as to why. And Mark Manson has two theories. One of them is screen time. The fact that screens have entered into our personal lives when we're going to bed at night, we're looking at our phones instead of connecting with our partners. Also, to get super scientific about screen time, there's a lot of blue light. When you're looking at screens all day, especially during the pandemic, we were sitting in front of a computer. When you're looking at your phone screen, your computer screen, blue light actually impacts our hormones. There's a whole episode about that from To Be Magnetic and Almost 30 with the founder of Blue Blocks. It's really important to understand how screen time not only affects just our connection with people and our communication, but it's also impacting our hormones. And it may be decreasing our libidos overall because hormones definitely rule the world. The other theory he had, which kind of is interesting and kind of goes against the fact that I'm doing this podcast episode, is the fact that sex has been so normalized and that there's no mystery to it or there's no taboo. He thinks that because we are talking about it so much, it's less exciting. And psychologically speaking, we want to have sex when it's more taboo. And I don't know, how I feel about that, but it's really interesting to consider. Regardless, I did want to have this conversation and talk about it so that we could just explore ways that we could have more sex and better sex because, again, it's really important to our health. So in this episode, I speak with Dr. Jessica Waldron, who's a clinical psychologist and a sex therapist, and she works with a lot of couples. We cover a lot of ground. So I'm going to tell you at a high level what we'll be talking about today and then just dive right into the episode. So we talk about turn on and turn offs and how we can eliminate the sexual breaks. We talk about sexual chemistry between two people. Does it need to exist off the bat or can it be built? We talk about communication around sex and how do we build a better expression of our needs and have productive conversations with our partners about what we need and what we like. We also get into the use of drugs, talking about Molly specifically and how it can help light a fire under our sex lives. And then we also talk about how often we should be having sex, should we schedule sex, sexual pain and what that looks like, and the different types of pain. My favorite topic, cycle syncing. I love Alyssa Vitti and how balancing your hormones can actually help optimize your sex life because it can increase your libido. But also, cycle syncing can help you build a better understanding of where you are in your cycle so that you can tell your partner what you need. And then mindfulness and how it can lead to better sex. So without further ado, let's get this conversation started with Dr. Jessica Waldron. I would love for you to do a quick intro for everyone.
Cool. So I'm Dr. Jessica Waldron. I'm a licensed clinical psychologist. My specialties are in relationships and sexual health. I currently see a lot of patients, individual patients in a private practice, and also couples, working physically out of Nashville area, but like I don't know how to say it or what word is right, but like most of my
Virtually clients.
virtually, I am like still in California, but looking to kind of expand into both places. So most people I meet with are out of California.
I have a
Yeah.
question actually on virtual versus in-person visits. Do you think that Zoom has made it easier to be more vulnerable and share things, or has it made it harder because you're like in the closet at home, like trying to muddle everything that is going on outside?
Yeah, it super depends, right? So for some people, even, I mean, I was doing some telemedicine before even the whole COVID thing, and now it's everybody. Um, that little bit of distance, I think, for some people allowed them to feel more comfortable kind of getting into their emotions. And so sometimes I would find it useful to use the telemedicine sessions to deepen because, it can be kind of intense to be in a room with one other person. It's a very intimate setting, and to allow yourself to feel or really be in your emotions or in your body. But it kind of depends, right? So I've had people where it's made it more tricky if they have kids right outside the rooms. I'm working with a couple and their kids are right outside the door. I can imagine that creates where they can't fully be present in here. If you can hear a little noise in the background, you're wondering what your kids are up to. I think it kind of depends if you have roommates, things like that. But for a lot of people, I think it's created a lot more access and consistency. Like my patients I work with have never been more consistent because they're home and
Yeah.
it's generally private and they're on their computer anyways. And so there's no like, I can't make it. I have work, I have a travel plans or whatever. So mostly people have been like super consistent in therapy.
That's good to know. Yeah, I think there's some trends that are coming out of COVID that may be sticking, just like this whole Zoom thing when it comes to therapy, or even like, I mean, we did a breath work session. I don't know. It kind of is, it's nice to be able to do it from the privacy of your own home, but definitely miss that in person contact. So, in your practice, what are some of the most common themes you're seeing, and have they changed over the course of the last year? I imagine they have, but just in terms of like, I know you see a lot of couples experiencing relationship issues, a lot of that can revolve around their sex life. Has that gotten better or worse during COVID? Would love to hear the trends.
Yeah. I think if there's a specific trend. I mean, we see a lot of what I see in my practice and sex therapy specifically is I see a lot of, particularly with couples, like a lot of desire discrepancy. So we have one lower desire partner than the other one, which is creating some tension or some conflict in the relationship. Usually the higher desire partner is wanting more from the lower desire partner and then there's just a lot of tension around that piece. So I'll see a lot of that coming in to my work. And then I'll see other things like, trouble having an orgasm or arousal issues like erectile dysfunction, things like that. And so I think has continued to be pretty, similar to what we were seeing before, but it has gotten more complicated, I think, in the fact that a lot of these couples are in the same space all the time. And we were so limited on the kinds of novelty and stuff and energy that we could fuse into a relationship. So a lot of the core work we were doing was still the same, really exploring what are the barriers that are coming up either in the individual or in the relationship. How do we work through that? How do we understand the issues coming up? And then trying to bring in new things, usually try new things, particularly with a couple. And so with COVID, it created some challenges in adding novelty and new energy, right? So sexual desire likes distance and mystery and creativity. And these people are like, I've literally been with this one person for a year. And so the challenges with creating new fun energy were definitely there.
Can I ask a question about novelty? Because it's so interesting. Because, when you're, with your partner and you tend to like go somewhere new and explore something new together, vacation sex is the best, right? Because you're like somewhere new and somewhere exciting. What's the psychology behind that? Is it because you guys are both experiencing something together and it's a bonding moment?
Yeah, I mean, I think there's a few things. So when we think about like sexual desire, sexual energy, stuff like that, we think about both like what are the things that turn us on and get us excited, and what are the things that turn us off and kind of drum down sexual interest or arousal. And both of these things are kind of competing with each other simultaneously all the time. So if we use that as an example, it's like when we're in our day-to-day life, there typically is a lot more offs, sexual breaks, if you will. Like, right, the house is messy, work, computers, the humdrum of day-to-day life. Like, did you take the trash out? Bills, financial stress. It's just like can really turn a lot more offs on.
Yeah, they're not. I don't know anyone that gets turned on by bills, but maybe.
I'm sure there's someone. There's something for everybody, right?
True.
So then we see a lot more of those like daily stressors and offs, relationships. I think when we go somewhere new, we get to shed that. We get to experience novelty. Our senses get activated in new ways, right? We're tasting new food, or we're on the beach and we get like the breeze or the salty, air and water. We see our partners in a new way. So when we're in our house day to day, it's like, yes, I see you. I see your laundry. I see I see you maybe just in your parent role or in your job role. But when I go out and we have an adventure together, I see you in this like new kind of exciting way. So I think, and then we tend to have less offs, right? Because we're in a hotel. We don't have to worry about all this stuff. Maybe we're away from our children. Maybe we're having delicious food and we feel good. We got a fresh tan or something. So I think it's, mixed, and there's a lot happening in our day-to-day lives that don't promote a lot of good sexual energy.
Yeah, I love what you said about, so there are turn ons and turn offs. And I feel like a lot of people are focused so much on what's going to turn me on versus let's eliminate the turn offs. And I love that concept that you talk about. Can you talk about like how, okay, if we're not able to go on vacation, which hopefully things are opening back up, how do we focus on getting rid of those turn offs in our everyday life? Is it like, is it little things like if you can afford a house cleaner, do it, because then you won't be worrying about who's going to wash the dishes or who's going to take the trash out. I know that's like a very privileged example, but are there any like little more practical things like that can help somebody eliminate the turnoffs? And also, like, how do you know what turns you off?
There definitely are such a wide range of things. So when we think about what are all the factors that are playing into whether someone says go towards sex or someone says breaks towards sex, it's very individual. So no one person has the same little ingredients, right, that are going to get them there or get them away, because they're really based on life experience. So we're thinking about a lot of different buckets when we're thinking about the different factors that turn us on or turn us off. And they're not so direct as just like, oh, my body feels aroused, or I'm having lubrication, or I have an erection. We're thinking about all the different parts that make us, part of us. So psychological factors, emotional factors, relational factors, right? Are we having tension? Are there unresolved issues in the relationship? Physiological things. Are we experiencing, tension in our body? Is there medical illness, physical stuff going on that could be impacting us? So it does get rather complex. But what you have to so you have to take like a personal inventory of yourself, really looking at all these different things and thinking about what happens for me, or what do I notice in my body, or what thoughts pop up when I, move towards intimacy with my partner or with myself. What am I feeling in my body? Do I have like, low self-esteem? You really have to start tuning in to identify what's coming up for you, and also exploring what feels good and what kind of gets you out of the off space. So it's a bit of a personal exploration, and then once you have identified some of that, then yes, you have a whole range of things, really practical things you can do. Some are more intense, right? So if we're talking about someone where there's trauma, or there's maybe very conservative religious values that they had growing up that they no longer ascribe to, but are very much programmed in them, this is going to be a deeper level of work. If we're talking about, I'm just really tense in my body after a long day of work and putting the kids to bed or meetings, we might just be talking about taking 15 minutes to breathe, taking a bath, winding our body down, doing a mindfulness exercise, and then we're going to feel the on start flowing. So it's kind of depends. It could be very simple or a little more complex.
I have a little bit of a complicated question. I'm trying to think about how to ask it, but when in some cases there's the issue of chemistry between two people, and hopefully you have a partner that you have chemistry with. But in some cases, you may be with a partner that is wonderful in so many ways, but chemistry just wasn't one of those ways, and maybe it wasn't a priority for you and it wasn't important, but now you're like, well, sex is important, but I've never, we never had that kind of passion or chemistry that I imagine, maybe some other people do. Is that something that Is it just something inexplicable that we can't fix and we have to work around it? Or is it something that we can develop with our partner?
So you're talking about like sexual chemistry, right? So like
Sexual
chemistry
chemistry.
yeah. Okay.
Yeah. Like I want to.
So maybe you're like, you feel you have this really warm, this really loving, intimate relationship. Everything is good, but the sex has always been kind of bad.
Yeah.
Yeah. Yeah. Yeah. I've seen quite a few couples coming in with that. I mean, it can just even be a hard thing. Sometimes there's one partner who thinks the sex kind of bad, and then there's another partner who didn't really know it was bad. And so how do we even start to address these issues gently? I mean, I wouldn't go, oh, it's just never going to happen. There's a chance. I've seen that, right? Where people have really worked hard to, dive into their sexual identities, things they like as a couple, try new things, really try to build that, even though maybe they didn't have it originally. And it's just the dynamics, because what drives sexual energy and tension, right? It's like these factors are so complex about what gets someone excited, and sometimes that just doesn't show up in that other person, the very specific things that drive your thing. But I will say there's usually a ton of opportunity in between that and here, in that, saying that that'll never happen. Because a lot of times people aren't communicating about sex or sexual preferences or likes. They're kind of just like jumping in. Maybe somebody's has some anxiety around sex. Maybe someone's not really expressing themselves fully sexually because they're worried that if they did, their partner will think that they're weird or it'll be too much for them. So they suppress. So there's a lot of times where people's sexualities are suppressed. And if we can create a safe space for exploration and curiosity and playfulness and fantasies to be okay, we can bring in some more excitement and stuff. So it could be that one or both partners haven't found comfort in that space. And once we like free them, more can happen. So again, it's not yes or no. It's just, it can depend.
Can we walk through like a practical example and a tactical example of how somebody would do that? So let's say I'm in a partnership and maybe my partner I don't know if he thinks our sex is good, but I'm not really feeling fulfilled and I'm not really getting what I want. And I'm, having fantasies about other people maybe, or I'm just like, what is going on here? Because I love my partner so much. Can I make this better? What
Mm-hmm.
can I do as step one? Like, how do I communicate that to my partners? I obviously don't want to say, like, hey, guess what? I don't think our sex is good. I just don't think that's going to work. But maybe it's more around communicating my needs. But how do I do that? And how do I do that in a way that I trust it? Like you mentioned, some people may be afraid that their partner might think it's too much or too weird. Like, what if
Mm-hmm.
I want a foot massage and he hates feet? Like, what how can I communicate this to my partner to make sure that I'm getting what I need and I'm feeling sexually fulfilled?
Okay. Yeah. So I think step one, and I'll just say maybe, maybe this is obvious, but for a lot of people, I find that it's not, is actually knowing first, is actually knowing yourself individually, what you like and what you don't like, or what you want to explore. So sometimes we just go in and we're like, oh, this isn't feeling good or it's not very satisfying, but we actually don't know what we like. We haven't really taken the time to explore our own body, our own sexual interests. And then we just kind of expect our partner to kind of like know how to make it, you know, on fire for us or just know what we would want. So I think definitely personal responsibility for your own pleasure is big.
Mhm.
Um, So that would be the first step. And that can look like spending some time in like self pleasure, masturbation, reading erotica if you want, thinking about what turns you on, trying new things, allowing yourself to see what your fantasies are, see what are the things that maybe catch your attention in a movie or in a book or that you're drawn towards if you decide to watch porn or something, what categories. So, really knowing yourself in this area. And then, yes, I 100% agree that you never want to go to your partner and just be like, the sex is bad or you're not good. Or, people do this and like it is crushing. And it's one of those things that can just annihilate someone's self confidence. It's already such a vulnerable area. So definitely always encourage people to communicate about sex, particularly if it's something you're wanting to talk about doing differently or that maybe the other person could read as criticism or, oh no, I'm not doing it right outside of the bedroom, outside of sex. Like you don't want to criticize or be like, oh, that's not what I like in the moment. That can really have a detrimental impact on your partner's self confidence in that space and just make them like want to crawl into a turtle shell. So
Yeah.
you want to open up these conversations when you guys are in a good, loving, connected space, where there's just a lot of warmth
Mhm.
that you can kind of hold there and just more bring it up as like, hey, like I've been thinking about how, let's think about it in like a strengths based way rather than like a weakness or a deficit. Like I've been really, wanting to think about like how do we kind of like really enhance our sexual connection or try something new or like is that, just bringing it up in a positive way. So that person's like, oh, cool, I'm on
Yeah.
board. Yeah, this would be fun.
What if they don't think it's cool and they look at you and they're like, what do you mean? Do you not like our sex? Like, do you not think that I'm like, are you not fulfilled? And then,
Yeah. Yes, we have a very defensive partner. So, I mean, you may, you can only, in all relational dialogue, you can only control how you come, how you present it in the best way possible. You can never fully control how that person's going to respond. So, if it is a very defensive area, yes, this may be a hard thing to talk about, and that's an issue, right? If you can't talk about sex with your partner and preferences and likes and have nice open communication, this is an issue. So we want to name it as such. However, if your partner is just a little bit, is still open, but they're like kind of are like, oh no, we don't really usually talk about this, like something must be wrong. Again, just really validating, like, I just want, there's some things I want to try. There's some things I think that would make, it more fun. And what about for you? I'm sure they're, ask them, right? I'm sure there's things that would make it better. Like, don't assume that they're getting everything they want and you're the only one who wants it to be better, you know? And so be like, I just, this is a big, important part of our relationship. And I want to make sure that it's going, that it feels good and we talk about it. So really just trying to soften the worry to open up like really good, open communication about it. But
I like that concept of personal responsibility too, because I don't think you can just place blame on somebody else, especially if you're not being vocal about your needs and you're like, I like my feet being rubbed. I can't believe he doesn't do it this way. He doesn't know. He never said it to him. So just being more, just being more vocal about your needs and what it is that you like and what you don't like, and making sure you feel comfortable. Because to your point, you can't talk to your partner about what makes you feel good and what you want more of. That's an issue. If they get defensive, like, what do you mean I'm not doing enough? And like, and they're taking it personally, then you want to take a step back and say, wait, this isn't like about anybody. This is, let's like come together and look at our sex as almost like a separate thing. How can we contribute to that activity together so that we're both having so much fun and we're both getting pleasure out of it? Because I definitely think knowing what it is that you want and making sure you're being vocal about it too is super important. I have a quick question. How do you feel about incorporating some drugs into therapy? There's been a lot of conversations around using MDMA, Molly, to get couples back into their, into their groove when it comes to sex. What are your thoughts on that?
Yeah, I mean, I don't have like a specific yes or no. It's not something I've incorporated into my practice. It is something we've incorporated into the clinic, or we're starting to incorporate into the clinic as research validates the use of this stuff more and more. I mean, I'm definitely open-minded to all different things, and I think it can be powerful. Obviously when used under the supervision of a professional and all of that. But yeah, I mean, whatever it is that works for you. And I think there is research and stuff that starts to validate that. And then that's where I can sort of, for me, as a doctor and stuff, can start to feel comfortable suggesting something as part of treatment.
I just want to put a big disclaimer out there that it is, something, you said something that was really important, and it is important to me personally for various reasons, but taking these things under the supervision of somebody who knows what dosage you need is so important, because these things are not to be taken lightly. They can have an impact on your brain chemistry. So I think the use of them is really beautiful when they're done right. So anyone who's listening who's like, oh, let me just take some Molly with my husband, just try under like professional supervision first. That would be my advice. But like, yes, everyone, you do you, but just a disclaimer here real quick.
Yeah, I'm on board for that too. For sure. For sure. You want to make sure you're getting what you think you're getting and all of that stuff. So always want to
be as careful and thoughtful as possible with that stuff. It's not just candy. Just a really simple, and I know that it might be an answer of like, it depends, but how
that's like a psychologist's favorite answer. Like, nothing in the world of psychology is black and white, sadly.
How often should couples be having sex? What's the norm? Like, how do I know if we're not having sex enough? I feel like sometimes people are like, I'm not having sex enough. I'm only having sex with my husband or my partner like once a week. And to some people, it's like, it's really good. I haven't had sex in a year with my partner. So what's normal? Not normal, because everything's so, obviously people are different. But what's the standard? What do you think is healthy?
Yeah, I think healthy is like a nice word to put on it versus like normal. And I wouldn't, I can't put like a number, like, of course, because it's so varied, right? And, but what I would say is regular, if that makes sense. Like
consistent, like a regular cycle. So whatever.
Yes, if it's once a month, it's once a month. If it's, I typically think if it's happening less than once a month, in my experience, I don't have like research to say this is a fact. In my experience, we start to see some hiccups in the relationship if it's less than once a month, unless this is just not a part of the couple's relationship, and they're both totally fine with that, which definitely happens. So for some of those people, it can be years. It's not distressing. It's okay. They still have a loving relationship. It's kind of a shared mutual thing. Now, if that's not the case and one or both partners does really want to stay connected and make sex a part of their relationship, I would say less than once a month, we're starting to hear the it's been months, it's we never do. We start to, so I would say regular, it's a part of your relationship.
Got it. Got it. Okay, not to beat a dead horse, but let's say it's
Yeah.
not. You're listening to this and you're like, okay, I'm not having sex enough with my partner, or I'm not enjoying it enough. Obviously, step one is to maybe figure out what like my own responsibility for it. So step one is really a lot of self-awareness around where I am. Do I feel confident in my body? Do I feel sexy? Do I have a sex drive? Do I have a low libido? And we can talk a little bit further, like more about that in specifically, but more around like, what do I like when it comes to sex? And kind of make sure you're aware of that, and then come to your partner and say, hey, I realize, like, just in taking some inventory of like what I really like when you do this. And I really like when you do this. Can we do more of that? And see how that goes. Is that right? Did I get that right? Or is there more that you would do when, just like as a first step to addressing a potential problem? I'm not saying there is a problem, but like just a potential like optimization of your sex life.
Yeah. Yeah, I think that is super important. I like, again, it's like almost in when you're like helping your small children, you want to say what they should do, not what they shouldn't do. Same rules apply. I mean, most things apply throughout our life. We think we like make some big evolution into adulthood, but we still like all need the same exact things. I love leading with what to do more of, not what not to do. And then there's other, then there's just going to be like, honestly, in kind of the modern day couple is busy scheduling and stuff like that. And so, scheduling sex is not off the table. It works for a lot of people. Otherwise, it doesn't happen. We schedule everything else and those things happen. And then the things we don't schedule don't happen. So that, or whether you infuse a regular date night, whether you decide to take a getaway, I know this isn't possible for everybody, to prioritize that part of your relationship. I think just talking about it first and then trying to come up with like, how are we going to like get this back? Like, what do we need? What should we do to kind of bring some energy back into this and make sure that this is happening in our relationship? Because it's important to both of us.
Yeah, that's a really great point. What if you're the one with a lot of desire and
Mm-hmm.
you're like ready to go all the time and your partner just seems uninterested? How can you help them, or what's the best, first step if you're the one that's like totally fine, you think sex is great, you want to have more of it with your partner, but your partner's the one that may be having some issues where they're not, or you feel as though they're not interested in you, or they don't have a high sex drive. How do you address that?
Yeah, it's hard to be that partner. It is because, well, it's hard to be both partners, to be honest. It's a hard role, the person who wants more um, and can't totally relate to the other partner. Like you said, it can feel like your partner's not attracted to you. You can take it personally. People on that side, their insecurities and their minds kind of run wild with like why their partner isn't interested in them. And so that can be a hard piece. And then often because the other person who has lower desire kind of knows they're not meeting their partner where they're at and is probably making them unhappy or there's more they want, they're usually like really anxious if the topic comes up or kind of defensive or kind of avoidant because they don't know what to do and they're struggling, but they don't. It's like, oh no, they're coming towards me with this thing and I don't know, and it's overwhelming. And so, and then that person on the other side who wants more is like, okay, like if I go try to talk to them about it, they kind of close up or I make them anxious and I don't want to make them feel bad. The point isn't, and blah. So that's what I see a lot of. They come to me, right? It's helpful to have an outside person because it's such a emotional and kind of vulnerable space to like hold it all for you and to like really just help them weed through it because it can be a hard thing for the couple to weed through on their own because it's so easy to hit on buttons and stuff. So I would say, going to a sex therapist is a great option if you can, just to have that person help you. But I would just try not to personalize it, try not to be critical or defensive or blaming. Usually it's not like, sometimes it is. Sometimes the sex is just not sex they want to be having. So you probably should know about that so you can be a better partner. And then a lot of times it's not. A lot of times it's just changes that have happened in their bodies or their experience or all sorts of stuff. And so you want to just, again, like when we talked about earlier about how you communicate, not in the bedroom, not in a moment of high emotion or vulnerability, but in a time of loving time, a time when you're feeling connected. And then really trying to create a safe space for us to talk about this really openly and challenges. And that can be hard because the person with the higher desire really has to manage their emotions about feeling like my partner doesn't like me and they're rejecting me and da da da. And so, because that can really get them worked up in the moment, which then sends their partner is thrown off and now has to take care and say, no, no, it's not about. And so we want to have productive conversations about this.
Totally. That's actually a really great segue into sexual pain. And I know this is an issue that some people may experience where sex is not pleasurable for them. It has nothing to do with the chemistry or like the actual other person, but may have to, or maybe it does. I don't know. You tell me. But they are experiencing pain during sex. What does that look like, and how do you resolve for that?
Yeah. So typically this shows up for females, and there's a couple, there's quite a few things, and it's not always the most well understood area is this pain. So you'll hear from women often who have been to many doctors and they're experiencing sexual pain and they're just like, I don't, like everything looks fine, like try this cream or whatever. So it's not an area that we always have the best understanding or treatment for that all OBGYNs are really versed in. But there's some typical things. There's like vulvodynia, which is like pain on the vulva, like the outer part of the female genitals. And then there's vaginismus, which is like pain upon insertion. And the vaginismus is really just very tightened muscles. And so any penetration causes quite a significant amount of pain. And then there can be a range of other things, hormonal things happening, improper lubrication. And, I've heard cases of a pulled muscle internally. We have like endometriosis. We have a range of different things that could be leading to pain. And so the big thing is it's not normal. So if you're having sexual pain, you need to respect that as not being normal and go seek treatment or diagnosis and get some support with it. And don't push yourself through sex when it's painful, because your body is sending you a pain, alarm bell telling you that something's up, right?
Yeah.
That's what the pain is there for. So you don't want to ignore it. You don't want to grit your teeth and just bear through it, because that will create a cascade of negative associations with sex that will create other issues. So start with your doctor, your OBGYN. If that's not satisfactory, then try to seek out like a sexual health, a more like doctor with sexual health specialties, like a medical doctor can see a sex therapist to kind of support you on that process. A lot of times people will live with sexual pain. And then, like I said, there's kind of this cascade of secondary and staph effects from the experience, and sex becomes really associated negatively. Their bodies tense up. Becomes a more complicated relationship. Then we can do some of that work too, of unwinding that conditioning and getting them to kind of really start to be back in their body and to be their body, not to associate penetrative sex as threatening to them, because your body will start to do that if you push through it. Even if your mind is like, no, this is my partner, I love them, I want to have sex with them, your body's like, no, you didn't listen when we sent those pain alarm bells. You didn't listen, and now we're going to shut you down, because you clearly aren't going to take care of it yourself. So you want to address it.
That's definitely really helpful. And those are some, do you have any helpful resources that for somebody who is experiencing some pain can go to?
I mean, you can, really want to start to understand just what is causing it. It's really typically the pain that we'll see is a little bit more of a physical medical type of condition. So when you go, to something like an online resource or anything, you can learn about the different types, but you really want to get a assessment to identify what it is. Otherwise, you're not going to be treating the right thing. So something like vaginismus, which is the really tightening of the vagina where it's hard to get insertion, there's a lot of things you can do. And the person you'll typically see is a pelvic PT who will give you these dilators, which are kind of like little vibrators that go from smaller to bigger. And so you learn to relax those muscles and move up in size. And so you get that kind of biofeedback, you learn to soften those muscles, and that can help, right? But if you have another condition, you're dealing with something else. So I would say, you can learn about what they are. I think I have on a blog post some on my website, some different resources for sexual pain, like some online ones you could start. Really, you just want to get somebody in there and start evaluating what is actually going on.
That's super helpful. One thing I wanted to talk about too is I know you're into cycle syncing, and I love cycle syncing, and I love Alyssa Vidi's work and her whole world of flow living. And something that I learned when I started doing this is that your libido is not the same throughout the month, and or your, like your ability to get aroused easily is not the same throughout the month, because as women, for men it's different, but as women, our hormones are very different every day. Men are on a 24-hour cycle, women are on a 24-hour and a 28-day to however long your cycle is, 35 days maybe. There's definitely in the app, I always found it helpful, like, oh, you're in this phase of your cycle, so you may need a little bit more foreplay to get going because you're like, you need a little more love, or you're in this phase of your cycle and you're like ready to go. You're ovulating, you're good, you're glowing, you're attractive, you're set, like all of the things are working. So
Yeah.
I just want to call that out. Have you used that in your practice and your patients just to make them going back and tying it back to that self-awareness that, that we need before we even go to our partners to say what we need? Have you used that in your practice to make sure your patients are kind of building their own self-awareness and understand how their own body works too?
I haven't, but that's because I'm just getting into like understanding this and I love it so much. So I definitely 100% would. And I'm trying to like incorporate more of that because I think it's so important. And what I love about her app, what's it called? Flow Living or
Yeah, My
Flow
Flow. The app
Living?
is called My
Yeah.
Flow.
My Flow is she has like a little letter that you can send to your partner, depending on where you're at in your cycle. And I'm like, oh, hallelujah. Like how helpful, because I think as women, we know intuitively that there's times, before we have this great information, we just know like, oh, sometimes it's so easy to just get
Get going.
going. And sometimes like that is like, sounds like the worst thing in the world, it would be to have sex. It's like, you're like intuitively, and it seems to happen kind of cyclically, like this is before, it's like, seems to be every few weeks, like roughly
Yeah.
I go through this thing that's happening. Right. So I think intuitively feel that, but we don't always have the language or really even know until we are fortunate enough to come across some of this really good work about what's going on. So I 100% would love to incorporate more of that. And I think it's so empowering. And like, I think the partner would be so thrilled to have insights and to be able to feel like they can approach their partner in from such a better place of understanding and meet them where they're at, and less personalization of if my partner like isn't down right away, like it kind of makes sense. Like I get it. There's hormones involved, and it's not either one of us, it's not related to either one of our like love or how much we're attracted to one another. There's just like some biological stuff.
Yeah, I think it's so helpful. I mean, there's been that like saying that men have always asked for like a manual, like give me a manual to figure this out. It's like, well, actually, there's not a full manual, but when it comes to arousal and sex, there is kind of a little bit of a manual, and I can give you some help and just allow you to see where I'm at, which I think is so helpful.
I love it. I had a therapist say, she's like, hormones rule the world.
Yeah,
Yeah, they kind of
they
do.
really do. They really do. That's why, like, I love Alyssa Vini's work so much because everything is hormonal. Not to get into a whole spiral into a lot of other
I love
topics,
it.
but I think when it comes to sex, I think it's definitely there's a lot of hormones at play, obviously. So understanding where you're at, both as men and women, is super important. Before we wrap up, what are some other practical tips you have for just better sex in general? I think the self awareness piece is huge. Scheduling sex, you mentioned, which I think is really. I think a lot of people might think is like not sexy to schedule sex, but it works, right?
Yeah. I
Okay.
mean, it's like, I tell people not to get in their own way. A lot of times, usually you don't need to schedule sex at the beginning of a relationship, so that's fine. But usually, you do in a long-term relationship often need to at least set some intention or plan, communicate, hey, like, Wednesday night's our night or whatever, because otherwise it won't happen. So if people push back against the scheduling, it's like, okay, well, you can either schedule and then there's like a much greater chance that you'll be intimate with your partner, or you could not, and then things could just continue status quo and you don't. So, which, we have to kind of get out of our own way sometimes. I get it. It doesn't sound that sexy, but it works. And
Yeah,
once you're in
yeah.
the moment, it's all the same. It feels good and you enjoy it and you're more connected. So,
And it's something to look forward to too.
yes, yes. And that positive anticipation is a huge piece of sexual desire and satisfying sex. So you want to infuse talking, flirtation, anticipation of that throughout your week. So yeah, if we're like, oh, Wednesday's coming up, I can kind of think about it. Hopefully you're not thinking about it from a place of, oh no. Sometimes that happens, but that's okay. Come as you are. But yeah, building up anticipation is great. Okay.
Yeah. Yeah, I like that idea of like flirting around it too. Like if you're scheduling it around it's Wednesday, you can like, send a flirty text like can't wait for Wednesday. And it's kind of like dating again because it's like scheduling a date or I don't know. I think there's something to it and you can make it sexy and make it a little like it doesn't have to be spontaneous to be sexy.
No,
So I like
no.
that. I like that idea. What are some other just like high level tips that you'd recommend, just generally speaking, for better sex?
Yeah, so I think a big, big, huge thing I see with people I work with and just in general is we just spend so much time in our heads, thinking, worrying, planning, da 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 da. So this being in our heads really has a negative impact on our sexual arousal and desire and being in our body and experiencing pleasurable sensations. So I think mindfulness is wonderful for a range of things, but practicing some mindfulness, building that muscle if you've lost it or never had it, of really being able to let the stuff of the day go, the worries outside go, and just be in your body in the present moment, experiencing what you're experiencing is a huge thing for experiencing sex and being there for it and not letting the things that typically inhibit it show up, which are anxiety or thinking about other things or worrying about other things. So, big one, getting into your body, using mindfulness, and it can just be regular mindfulness that builds that muscle so that when you show up to sex, you've built that ability to be in the present moment. We talked about communicating. I think that's a huge one. We don't communicate it about it enough. So often we're holding on to a lot of misconceptions, assumptions about our partner, assumptions about our own sexual functioning. We think we're not doing it right, or it's not, or we don't know. We're just all in our heads. So opening that door to communicate. I'm sure you communicate about a lot of other things in your life, in your relationship. This should be one of them. So those are two big ones. And then, address any issues, get educated, seek good quality knowledge about stuff that's coming up for you so that, you can address it and have a fulfilling sex life.
Super, super helpful. I hope this was helpful for everybody listening. I think so. I feel like we don't talk about sex enough because it is such a private thing. So I'm glad we're kind of making the conversation more open and we're normalizing talking about sex, because the more, like, when we become more open about talking about it, then it'll get better, hopefully, right? Like you said, communication.
Yeah,
So
I mean, we're just, people just hold on to so many insecurities or negative beliefs or misconceptions. So the more we can talk about it, the more people can feel informed and confident and have a positive experience of their sexuality.
love it. Thank you so, so much. Love
Yes.
this combo. Thank you so much for being here and supporting this podcast and listening. I can't tell you how much I appreciate you being here. If you like what you heard, please leave a rating and review on iTunes. It helps other people discover this content, and of course, it means so much to me. Thanks, and have a great day.